Likely here because you or someone you know may be struggling with addiction. The truth is, you wouldn't be here if these issues weren't becoming more and more common. To understand addiction, we need to have an idea of what decades of research has shown and what is most commonly experienced given the amount of stigma associated with addiction and substance use. We know addiction involves a complicated interaction of brain circuitry, genetics, our environment, and our life experiences, and that addiction can involve any form of substance use or behaviors that becomes compulsive and will many times continue despite harmful consequences. Ultimately, we can become addicted to any behavior that temporarily gives us that feel-good response through neurotransmitters in the brain. One example is dopamine, which can create an immediate feeling of relief regardless of the substance or behavior itself. I want to emphasize that these behaviors can include substance use such as drugs and alcohol, but also encompass pornography, food, sex, technology, social media, gambling, work habits, or even harmful relationship patterns. Many develop addictive behaviors as a way to cope with challenging experiences and emotions and to find temporary relief. The first step is reaching out and trying to gain more awareness and understanding of what is at the root of this addiction. However, what is just as important is how to move through it and how to gain the support that is needed to take back control and to strengthen your resilience towards a successful recovery plan. At the core of many addictive behaviors and patterns is attachment trauma. This is when life experience leaves us disconnected from early relationships, and even more so, our self-development. This occurs when early bonds didn't meet our emotional or physical needs, leading to less functional ways we adapted in order to gain love or approval. Many continue to turn to these addictive patterns as they provide temporary relief from our unmet needs and give us that brief feeling of connection. Finding this temporary sense of connection is so strong that it leads us back again and again, even despite exceptionally negative long-term effects. As our brain and body physically adapt to these changes, the need becomes stronger and more frequent. These feelings and changes can happen at any age and from a variety of experiences. However, if you or someone you know is experiencing addiction, the good news is that there are a variety of tools and techniques available to help you start and to maintain recovery. If there's one thing to take away from this part of your journey, is the awareness that you're not alone, and we're here to help guide you towards the skills and resources that can help you get through. Thanks for being here.